have to be carefully considered and evaluate why the core aspects of the healthy buildings revolve around features such as daylight, view, good indoor air quality, acoustic, and the thermal comforts. This has to be counterbalanced against the hospital's needs. Some aspect of the healthy building can take an even more crucial role in healthcare facilities, such as accessibility, infection control, and visitor wayfinding. Okay, so that's all from me.
Hello and Assalamualaikum. My name is Lukman Hakim from Group 2, and I will be talking about how training nurses to become even more better will improve healthcare in Malaysia. First off, when nurses is given such training such as developing critical thinking or even critical reasoning, which is an important procedure as nurses will learn more about the patient's sickness such as pain muscles, blood loss and much more. They will also develop critical thinking with such quick response so that the patient will be treated easily and way more faster. Not only that, but nurses have to make their decisions correctly based on the situation, so they need to develop critical reasoning to make faster reaction and decision skills. Second, by training nurses to become even more better, nurses can give patients resources to improve their life and disease outcomes. For example, nurses who were trained better are more aware with the knowledge of the diseases caused by some factors such as bacteria, viruses such as coronavirus, fungi, and even parasites. Third, nurses can pass medications and teach procedures to patients to help them achieve compliance with their health related needs. This will also help improve our healthcare system as nurses did not only treat patients but they can also recommend patients to be more cautious about the disease and practice to stay healthy. Furthermore, well trained nurses will also be strong physically and mentally as they will be strong enough to hold the pain during helping patients with dangerous disease such as coronavirus nowadays. For example, nurses who worked hard during the coronavirus era, which is now, has shown that they are getting weaker as they would work non-stop during saving a patient's life. By training them to be stronger, they can stand for much longer time to save even more life without feeling weak. Last but not least, nurses can improve a patient's health by teaching them emotional coping skills to handle stressful situations. This training provided to the nurses will be able to comfort the patient as they will stay calm in process of healing, and also they will be taught properly to handle stressful situations. That is all my points. Thank you.
In my opinion, the best way to improve our healthcare system is by reducing the cost of medicine. The way to reduce the cost of medicine is by prioritize the budget of our country towards medicine development and also working together with other countries to make the production cheaper so it can be mass produced. With the medicine be mass produced, it will reduce the cost of it due to how easy it is to get and how much it is available all the time. It can also help to make sure we do not run out of stock of the certain medicine if anything serious happen to our country. It will help us to prepare for upcoming disaster. Other than that, we should also make a standard price for the whole country. By making the price standard across the whole country, we don't have to worry about it being harder to get in places such as village or small town due to how high the price of it can be. This will help those who are part of smaller cities to not worry about needing to go to larger cities to get medicine. And finally, we should also try to increase the quality of medicine so that the amount of medicine needed to get healthy is lesser than it is right now. With the amount of medicine needed becoming lower, the amount of money needed to pay for the medicine should also becoming lower due to the amount of it needed is being lessened. That's it for my opinion.
Assalamualaikum, my name is Iman Daniel. I will be I'm from Computer 2 Group 1. I will be discussing about the importance of education in our healthcare system. First and foremost of all, in our primary school, we were taught about the 4 stages of the food pyramid. So in that food pyramid, it consists of bread, minerals, and vegetable in the lower part of the pyramid, while the upper part is more to sugar and fats. We were taught not to consume a lot of sugar and fats from the upper part of the pyramid because consuming too much of that will cause us to lead to obesity or maybe diabetes, while maintaining a good healthcare, good food 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 consumption will lead us to a better lifestyle, healthier lifestyle. Okay, we can see in most parts of Africa where kids don't pretty much have food to eat. They have lower source of food, so they lack nutrition and lack minerals. In where their malnutrition cause them to many diseases such as the arthritis or maybe diarrhea or maybe any other diseases. Okay, so for my second point is that with knowledge we can know about the symptoms about various chronic diseases such like the COVID-19 recently, which we are still going on. Okay, this we know about the symptoms is very similar to a common cold, which is we have a fever, we tend to cough and sneeze. Although this virus is very contagious even by contact. So when we know about the symptoms, we should take prevention. When we take prevention, we can avoid other people from getting it also. So we were told to quarantine ourselves at home and to limit our contact with other people. Then we should take an initiative to contact the health administration to provide us a test whether we are positive from the virus or we are free from the virus. Other kind of diseases such as the cancer, we have 4 stages of the cancer, which is the first to the fourth. In the first and second, if we took a better prevention and we take an early cure, we can still be safe from the cancer. However, when it reaches to the third stage of cancer, it is most likely doctors will recommend as the chemotherapy, in which a therapy that kills most of the cancer cells but not entirely all. It is a risky situation for both the doctors and the patient. But in order to increase their lifespan, most likely doctors will recommend the chemotherapy session. My third point for this education is that through technology and studies, in education, scientists and professors are able to make much more valuable technology stuff, such as the X-ray, which examine our bones, or maybe the blood pressure machine, which can measure our blood pressure. With the advance of education, our studies and technology, we can make much more better equipment in order the healthcare system to be much more efficient. Also, with scientists and studies going on, they make better medicine supplies, or maybe increase the effectiveness of the medicines. Most medicine these days take a shorter period of effectiveness rather than last time where it took days in order for the medicine to be effective. Okay, last and foremost of all is where during our primary and secondary school, our school used to have a curricular activity, and we have a choice to join in which we wanted to. One of the activity that were available to us was the Red Crescent Society, or maybe St. John. In this society, we were taught about the emergency first aid supply on how to on how to heal the wounded in wherever caused, so that it is just a temporarily assistant before the medical team arrived. But however, students who took the course were taking it lightly and not seriously. So in order to overcome this, maybe the school can organize a practical examination so that the students can know their skills in this course. I think that's all from me. But however, in terms of education in health, we've seen in social media on how much people have been sharing with us on such as, like example, how to carry a heavy load. We were told not to carry with our back bending towards the ground, as that will cause our back to receive a lot of pressure. We were told to lower down our body and also carry the heavy loads. As another example of maybe the effects of drinking a very hot drink, how it affects our throat and also our tongues. It has a bad disadvantage when we do it consistently. Also, the ones we usually tend to do is like watching our smartphone in the dark and prolonging earphone wear. It damages our internal cornea and also our eyes as well. Also, another common health tip that we used to hear is our sleeping time. Usually students and the young generation tend to sleep in at the day and tend to be awake at night, which is not good for our health. We were told there were tips given on why it is much more better to sleep at night, and much more of them all. So that's all from me. Thank you.
Hello, my name is Muhammad Mumtazah bin Ahmad Azmi, and I'm going to talk about healthcare and how to improve healthcare. And my point is more doctors to improve healthcare. So yeah, let's start. Healthcare is one of the most leading problems in today's world. The number of doctors is a constant, but the number of patients is always increasing day by day. Doctors are trained to diagnose and treat specific diseases and conditions. In addition, having more medical practitioners can help in decreasing the number of deaths, especially when it comes to critical and urgent cases such as accidents. Okay, there are multiple ways on how to improve healthcare in Malaysia. One of the ways is by increasing the number of doctors in medical section. Therefore, we can get multiple of benefits by having a large number of doctors. Firstly, by having more doctors, it is easier to handle the patients, since there will be doctors available to treat the patients on the time. As a result, the patients will be well treated and duties for the doctors will be more manageable. This can provide more hands in saving someone's life, hence the overall condition of the patients will be better. Furthermore, more number of doctors are required since COVID-19 appeared in this world. Doctors are totally indispensable to fight against this disease because they are the heroes in this situation. Certain doctors can be transferred to abroad or other countries to help others with the COVID-19 crisis. As an example, this can be seen when Malaysia sent several of doctors to China during the early stage of COVID-19 this year to prevent the virus from spreading widely against this world and treating patients in there. Besides, more doctors are one of the ways to improve healthcare, since large number of doctors can help each other during their patient surgery, so this helps save time and even the patient's own life. Since Malaysia is kind of like in specialist doctors, so by having more doctors in the medical section, they can help manage the departments that is especially lack of doctors. Also, more doctors can help them to focus on a few numbers of patients with a good care. More doctors can help them to focus on a few numbers of patients with a good care. Consequently, decision-making of the doctors will be more accurate since they are not burdened with a lot of stress. So this can increase the productivity of the doctor's work overall. So that's all for me. Thank you.
Okay, so hello, my name is Umar Hakim, and I am going to talk about the best way to decide which is the best to improve healthcare. My point is we need to train nurses better, because in this hard time, during pandemic, we need to train nurses to become even more stronger in physical and mentally, because they keep working day to night and feeling weaker.
Okay, but I think I disagree with your point, because for my opinion, nurses are just assistants to the doctors, and without the doctors, nurses cannot treat the patients. So for me, I think the best way to improve healthcare is by having more doctors, because I think with more doctors, it is easier to treat the patients since there are more doctors available on site. As a result, the patients will be well treated and the duties for the doctors will be more manageable. So that's it.
For me, I disagree with you. With your point, if we have more doctor but the hospital is too crowded, it can slow the process to treat the patient. So for me, I think hospital building can improve healthcare because the goal of developing hospital building is to improve patient experience through innovation, design, air quality control, thermal, and lighting.
I have to disagree with you. In my opinion, cost of medicine are really important. As in, if the price of medicine is really high, nobody can purchase it. So we have to find a way to reduce the cost of medicine so that even the poor people can buy it, even in our current crisis.
In my opinion, I agree with all of your opinion, but however, my opinion is superiorly important because without education, there cannot be any innovation through medication or through hospital, or even we can't even train the nurses better, and we can't even give education to make much more doctors. So, as a conclusion, I think that my opinion